Hello, today we have with us Miss Megan Chen. She's a registered speech and language therapist with more than 23 years of experience helping students with specific language impairment. And she's here today and we'll be glad to hear from her explanation of specific language impairment, SLI, and how she thinks students with SLI can get help. Thank you. Miss Megan, please.
Hello. Okay, today I'd like to talk about SLI. It tends to get confused with dyslexia, but dyslexia is where a child may have difficulty picking up reading. What happens in SLI is that a child may be able to read something, they may be able to read it very loudly, very fluently, and they sound very confident, but they have language impairment, so they are not able to actually understand what's going on, what they have read. So if you ask them a question about the story, they're not able to answer the questions. Okay, so I'd like to present some findings about SLI. This is based on an American study of more than 900 children and their parents. So the three main characteristics of SLI to watch out for are, the first one is limited vocabulary, meaning that a child may have a lot of words such as, and they'll talk more in terms of this thing, this man, that girl, whatever, something like that, without using the specific vocabulary, such as things like thermometers, very specific words. Okay. Next one, number two. What you notice is that they tend to use shorter sentence structures or very simple sentence structures instead of using longer, more complex sentence structures, such as sentences which are linked by what we call conjunctions, although or after or something blah blah blah, because, and so forth. Okay, so you see that the age peers are using longer sentences, but the child of SLI may be up to 2 years behind the peers in terms of sentence structures. Okay, the third area is grammar. So this one, they are even further behind. So whereas for vocabulary and sentence structures, they may be up to about 2 years behind their peers, what you see here is that for most children, we expect that as they grow older, we expect their grammar skills to get better. So they learn things like plural s, two dogs. They learn things like past tense, and they learn to use correct grammatical sentences. But a child with SLI will still pick up will still pick up grammar, but they do it at a much slower pace, and they tend to plateau after a while. So even at an age of about 8 or 9 or even older, they may use the wrong grammar, and they may say things like Caden go instead of Caden went. They may say, instead of he is drinking, they may say things like he drinking. Alright, so these are the three main characteristics: vocabulary difficulties, sentence structures, and also in terms of the grammar skills. Okay, so speech and language therapists are the people who will diagnose whether or not a child has SLI, and children with SLI can improve with therapy. In fact, it's really important to ensure that they get help early to avoid any implications on their school results, their self-confidence, and also to avoid any risk of bullying in school, because the studies have shown that children with SLI are up to 3 times more prone to getting bullied in school. They're not able to express themselves or even tell parents or teachers what happens. Okay, thank you for watching this video.